our next speaker. He's going to talk to you a little bit more about our orthopedics program and the joint program that we have over at Gardens. And he is a fellowship trained in total hip and total knee. He's also board certified orthopedic surgeon. He is a high volume physician, very committed and a great partner to the organization. He also sits in the Palm Beach governing board body as well. So with that, I'm happy to introduce Dr. Robert Avino to come up here and join us.
Thank you very much, Eric, and thank you very much to the NCNC for hosting us today, and thank you for my wonderful team at Palm Beach Gardens Medical Center, who's been very supportive over the last 3 years. Like Eric said, my name is Bob Avino, and I'm a fellowship-trained orthopedic hip and knee replacement specialist, and I focus on robotic surgery. And I'm very proud to share with you the total joint replacement program at Palm Beach Gardens Medical Center. I really believe that Palm Beach Gardens Medical Center is at the forefront of joint replacement. We're going to be talking about the surgical capabilities, the advanced robotic technology, a little bit about the comprehensive care program at Gardens, the Same Day Discharge Program, and share some of the accolades that Eric mentioned. Really, the surgical capabilities for joint replacement at the medical center are second to none. We have 4 orthopedic robots. 2 of those robots are the Mako robotic system. We have one of the Mako robots with us today. If you have time after the presentation, please come by and I'll give you a personal demo on the system. We also have the ability to do the direct anterior hip replacement, which is a less invasive way of performing hip replacement. This is an example of something called the HANA table, and we have 3 of these at the medical center. We also perform partial knee replacement, complex hip and knee replacement, complex revision surgery for our patients for joint replacement. We're able to provide joint replacement for patients that come into the medical center with hip fractures, and we're able to provide less invasive anesthesia using regional anesthesia, which has less complications. And we're also able to offer these surgeries to patients that are older, in their 90s, even patients that are over 100 years old, we've done surgeries on. So somebody actually came up to me and asked, is Palm Beach Gardens or is the robotic system in all hospitals, is this the way that we're doing all joint replacement? No, it's not. Palm Beach Gardens Medical Center was the first and is the only hospital in Palm Beach County to have 2 Mako robotic systems. What is the Mako robot? Well, it's a robotic arm that the surgeon controls to perform joint replacement. It allows us to do hip replacement, knee replacement, and partial knee replacement. Before surgery, surgeons are able to plan the surgery in advance before we even walk into the operating room. And this is based on a CAT scan. And the CAT scan creates a 3-dimensional image for us to actually plan where we're putting the components, what sizes we're going to use, and then we're able to even take the hip through a digital range of motion before we do the surgery, so we know, whether or not the hip can potentially dislocate based on our component positioning. If that's the case, we adjust our component positioning. Not only does it help us before surgery, but it helps us in the operating room while we're doing the surgery. We're bound by this haptic technology, meaning that we cannot stray off course. With manual instrumentation, you can damage the soft tissues, you can put a component in the wrong spot. With the Mako robotic technology, it's kind of like a coloring book. We set the lines of the coloring book, and you can only color within the lines. And we're also getting more information in the surgery. We know how tight the soft tissues are, how loose the soft tissues are, where to place the components based on that data in the surgery. What does this mean? That means that we're more precise. It's a more naturally feeling joint. There's less soft tissue damage, less bone is resected, less bone loss, and ultimately less pain for our patients. So this is a video demonstration of the Mako robotic arm. So this is the arm that I actually control in the surgery. After we make the incision, we control that arm. Before surgery, the patients will get a CAT scan. And the CAT scan creates a three-dimensional image for us to plan the surgery off of. This is actually a demonstration of us planning a case, and we're able to look at the patient's anatomy. We're able to look at, what their leg length discrepancy might be. Everybody's hip socket is different, so we want to size the hip correctly to know what prosthesis we're going to be using. And we do this a week in advance of surgery. So if we may be doing, just in my practice, we might be doing 10 joint replacements. The hospital may be doing 30 joint replacements in a week. We do all this before surgery. In surgery, we use a robotic stylus to marry up that CAT scan with the patient's own anatomy. So we actually touch different areas of the bone, and that overlays that CAT scan. So once that happens, we verify everything with little different checks where we place the robotic stylus, and then we can bring in the robotic arm into the patient's wound and to start removing the bone that is necessary to implant the prosthesis. This is a process called reaming or bone removal. So we're removing all the diseased bone-on-bone cartilage. And again, it's locked in place. We cannot deviate off path. Even if I tried to move off path, the robot would not let me. So it's a lot different than when you're doing this surgery manually and you can go off path. You can remove things that you shouldn't remove. You can place the components in the wrong spot, and that can lead to dislocations. The robotic arm is actually guiding us in this procedure and not letting us stray off course. And that leads to better component positioning. Then we insert a liner, which is made of plastic, a ceramic head ball, and then the rest of the hip replacement here is demonstrated. So why should patients seek out robotic surgery for joint replacement? Well, this is a very well-studied system. For the Mako Robotics, there's over 500 studies within the orthopedic literature validating its use and showing its effectiveness, and there's been over 1.5 million procedures performed with the Mako robot, and it's been on the market starting with partial knee replacements for at least 19 years. So what can patients expect with robotic surgery, or what is the literature shown? Well, less rates of complications, more enhanced positioning of the components, meaning that we're actually hitting our target when we're putting these components. Reduced dislocation rates. That's a devastating complication for hip surgery, the hip popping out of socket, and that can mean revision after the surgery. And there's less rates with robotic surgery of those types of complications. We're able to use less pain medication after these surgeries. There's less time in the hospital, and there are lower revision rates with robotic surgery. All really important things when considering joint replacement. So at Palm Beach Gardens Medical Center, we marry that with the comprehensive preoperative care program. Palm Beach Gardens Medical Center is now a one-stop shop for joint replacement surgery. Our patients come to the medical center 30 days in advance to receive their preoperative testing, their blood work, their chest x-ray, their EKG, and the Mako robotic CAT scan. They also meet one-on-one with a member of our anesthesia staff to get their questions answered, to go through their past medical history, and to identify any risk factors that they may have undergoing anesthesia. They also get to meet with our nurse orthopedic navigator. This is a specialized position where the nurse will go through with the patient and their family members. Well, what can you expect with joint replacement? How do I prepare the home for joint replacement? And how do we do this surgery safely? And so that's a joint replacement class that is done one-on-one at the medical center with the patient when they come in for all these other things that they're getting taken care of before their surgery. What about in the OR? Well, we truly have a specialized team dedicated to joint replacement surgery at Palm Beach Gardens. We have experienced nurses that are not only experienced with orthopedic care, but specifically joint replacement. If we're doing multiple surgeries, anywhere from 4 to 6 joint replacements just in our OR alone, well, these nurses come with us throughout the entire day. They're not moving to do general surgery or urology or cardiac. They're sticking with the orthopedic doctor to do the joint replacement. That means that as the day goes on, we get better and better. We get more practice. As the week goes on, we get better and better. And as the years go on, we get better and better. We also have the advanced systems that allow us to do revision surgery. So God forbid there is a complication, we're able to address that at the medical center. We don't have to transfer these patients to an academic center. We have dedicated and specialized physical therapists that are trained in orthopedics, and we have a closed orthopedic unit as well. So really, our staff is super, super specialized, not just in orthopedics, but in joint replacement. So when we put it all together with the robotic program and the medical center, we're less invasive, we have better outcomes, we're able to perform and offer surgery for more complex deformities, older patients. We're able to provide patients with less pain after the surgery. We have a quicker return to activities, and we have consistent quality using the robotic technology. And this means that we're happier surgeons because we're hitting our target, we're achieving our goals, we're being able to help our patients more, and we have happier staff because we're able to be very successful with these surgeries. And we're now able to offer patients the ability to go home the same day of their operation. So no longer are patients staying multiple days in the hospital or going to rehab. Patients are actually going home the same day of this surgery. And it's really because we're able to have the patients come to the hospital beforehand. We're able to identify any risk factors, potentially optimize them for the surgery or modify those risk factors. We have the same staff that is meeting the patient before the surgery. They're seeing them on the day of the surgery. They're seeing them in the post-operative unit, and they're continuing that continuity of care. We're able to provide them with regional anesthesia. That's the less invasive method of doing the anesthesia. So the patients are actually without a breathing tube during this surgery. And we're able to have them have the physical therapy that they would get in the hospital. Our physical therapists come right to bedside, get them up right away, get them moving, and show them how to safely get in and out of their car, go up and down stairs, and how to return home safely. So our patients are now coming into the hospital, having their joint replaced, and going home 2 to 4 hours after that surgery. And this is not just for patients that are in their 40s or 50s. We're even doing this for patients that are in their 80s. Just this week, we had a gentleman that was 86 that went home the same day and was very happy that he was able to recover in his own house after the surgery. So these are some of the achievements. These are some of the accolades that we've gotten from Blue Cross Blue Shield, Aetna, health grades. This is a picture of us celebrating our 500th Mako Robotic Surgery. This was just last year, and in a few months, we'll be celebrating the 1,000th surgery. So thank you again for having me today. Thank you again to my team at Palm Beach Gardens Medical Center. Thank you, Sal. Really appreciate the ability to present about our amazing program. Thank you.